My name is Tarun Jain. I'm a fertility physician, an associate professor and medical director at Northwestern Medicine in the Division of Reproductive Endocrinology and Infertility. Through our research, we've proposed this comprehensive hypothesis called the DART hypothesis. DART stands for Disparities in Assisted Reproductive Technologies. In essence, it's a broad term encompassing any fertility treatments, and in particular, in vitro fertilization or IVF treatment. IVF treatment is the most effective. They're unfortunately also the most expensive. Within our DART hypothesis, there are several categories. On the access side of things, we've found that there are patients who delay seeking care based on race, ethnicity, and cultural background. That goes back to perceptions of fertility and how fertility and infertility is perceived and understood by different ethnic groups. On the provider side of things, lots of providers also have implicit biases. There are delays in referral patterns that exist. Also, patients are not seeking care with their primary care physicians in a timely manner. And there's also not as many diverse providers that are out there. So all of these factors are leading to delays in access to effective treatments. And then on the outcome side, similar problems exist. Our studies and others have found that patients who are Black and Hispanic have poorer IVF outcomes. And this may be due to potentially underlying biological, genetic, environmental factors that exist. So that research is ongoing to better understand why the outcomes are worse for certain ethnic groups. Also, other groups have found that patients who are in treatment, they're more likely to drop out if they're Black or Hispanic. So they're not only getting worse outcomes, they're also not returning for care. And that it's not clear why that is. That could also be multifactorial, depending on their experiences going through such care. It's really a complex problem in trying to better deliver equitable care for all patients. The ethical aspects of delivering fertility care, in particular IVF, in an equitable manner is really important. We have to be mindful that different patients perceive treatments very differently. From a cultural and background standpoint, many people feel that this is a difficult topic to talk about. There's a lot of blame and shame and guilt associated with infertility. Because of some of those reasons, people tend to shy away from seeking such treatment. So as physicians, as providers, we have to be mindful of those things, bring this up in a very culturally sensitive manner. As more questions get asked and answers given, a lot of the misconceptions about it and the fears start to go away. Physicians can play a huge role in improving equity and advocating for change in many ways. One is simply being aware that this problem exists, and also then working on our own internal biases that exist. We all have some implicit biases to varying degrees, and we have to work harder at being aware and understanding those. Next up, physicians also need to be more vocal, being open and talking about disparities in general. We know they exist across all aspects of healthcare, and until we talk about them, we can't really address them. Another thing is to be an advocate with policymakers. So whether it be meeting with local lawmakers, congressmen, or also societies in our field, whether it be ACOG or ASRM, they all have lobbying arms. So I think we are leaders in our space, and we have to do more to improve equity ultimately for all people.